So I began my talk with an overview about our current understanding of the molecular classification of ALL, both in children and adults, and how that's changed over the last 10 years with the advent of new genomic approaches. I started this by saying a decade ago we had a relatively limited understanding of the genetic drivers of ALL, and we were really limited to about 5 or 6 major genetic changes that only accounted for half to 2/3 of cases of ALL, particularly in children. Now that we've performed much more detailed genomic analysis of the disease, we appreciate there's approximately 20 different subtypes of ALL that include numerical changes of chromosomes, rearrangements and mutations that deregulate transcription factors, as well as changes that drive kinase signaling. And these are founding events that define subtypes of leukemia, as well as secondary events that collaborate in the development of leukemia. I explained that these vary by prevalence according to age, and the subtypes that we see in children are often uncommon or absent in adults. And conversely, there are some high-risk subtypes that are much more prevalent with increasing age. And this observation in part, not entirely, but in part, accounts for the differences in prognosis that we see across the age spectrum. I also made the point that much of what we've learned now about the subtypes of ALL and the reason for why we hadn't appreciated them before is because the genetics are often somewhat complex, that the alterations are often not seen on conventional cytogenetic analysis, or the changes that drive a particular subtype may actually be diverse and not just a single change, but a set of changes that converge on a single gene or a single pathway. So at one level, this is very important for our genomic understanding, but it's also very important for management, because we now know that to accurately diagnose the disease, to perform initial risk stratification, tailoring of therapy, as well as using accurate precision medicine approaches, tailoring medications to patients and their mutations, needs this more sophisticated genomic testing.